a reaction when it came to the cannabis psychedelic therapist. So if you're driving, don't crash the car upon hearing those words. Just be careful. Keep your eyes on the road. Otherwise, yes, we're all for a special treat today. So meantime, I don't have much of COVID updates. I do want to say just a couple of words about one topic that I just did a video on. But before I do that, I just want to kind of take a pause and say that, we should all be sending positive energy to yet another place in the world, being Middle East and the entire mess there. And I know some of you here have close relationship to Israel. So do I. It doesn't necessarily allows us to feel justified on violence on either side. I think what just transpires there is awful, however you look at this, and there's never going to be any kind of forgiveness to perpetrators of the act. But I hope that there's some kind of a peace and resolution that will be found, and that the lives that were lost are not going to be in vain, and that there's going to be some longer lasting peace there. And lastly, but more importantly, I've been personally trying to find a meaning in this entire situation and been struggling with finding one. But I'm thinking of recording a podcast on my YouTube channel with kind of maybe a thought leader from Israel and a thought leader from Palestine, and somehow, I don't know. I don't know. I'm just saying that I've heard a lot of really polarized judgments, and I'm personally, just because of my history, I lived in Israel for many years. I went to undergraduate school there. I have lots of friends. I had friends of the friends who've been killed. Like, I'm siding with Israel on this one for sure, but part of me cannot ignore that many lives, innocent lives that have nothing to do with conflict, will be lost as results of this. And it's not a single-sided story. It never is. It's always more complex. So with that, maybe we can take a minute when we do a mindfulness practice and just kind of hold our thoughts there. And if you want to participate more actively in something like a healing service on Sunday that I know some of you are coming to, let me know. We'll send you a link. So the topic that I was going to present today, so I've mentioned a couple of weeks ago, there was a fascinating study on showing that the turmeric can be used very effectively for acid reflux. So what I thought I'll do, I'll just quickly in a minute or two before I do questions, we'll summarize the study. But I know some of you are very detail oriented, and if you want to learn a lot more, what I'll do is I'll put a link to the video I just put on my YouTube channel that outlines this in a much greater detail, and it actually goes through the entire study. I don't want to present the study in detail today just because it's on YouTube, but more importantly, I'd rather answer your questions. But the video is here, so I'm putting a link so you can just click on that. In short, fascinating study. So what they did is they randomized patients for a standard of care, which is a proton pump inhibitor called omeprazole, or just acid blocker, versus turmeric 4 times a day, 500 milligrams. It's actually curcumin, so and it was not extracted. It was a whole curcumin grown in Thailand, put in the capsules, given to patients, no processing, just like a regular powder. That may be quite critically important, because when curcumin turned into turmeric extract and put in the capsules, there's potential of loss of some of the terpenoids or some of the essential oils. In this particular extract, it wasn't. And it's a very frequent dosing. So you take it 3 times a day before meals, apparently works. If you look at how the study was conducted, basically it works better than acid suppressant. It decreases acidity more, and it improves functionality or functional status more. And interestingly, when you combine omeprazole with turmeric, you get worse response than one or the other alone. So that is it's a great thing that they did this, because you would expect, well, if you combine 2 separate ways of workings, then you would expect a stronger result. Nope, it was the reverse. It was worse. I don't have a good explanation for that, but that's why we do controlled trials, right? And it was very well done. So if you're interested in more, look at the link. Okay, and then let's do questions, and we'll stay on time. I'll probably take maybe 3 to 5 more minutes. Okay, got Pfizer. Monica writes, got Pfizer last Friday, had night sweats that night and the following day, body aches, headaches, fatigues, result the next day. Okay, well, thank you, Monica. That's about what we usually would expect. Most people had something like this, so it sounds like very, very normal. Now, by the way, somebody brought this up to me a couple of days ago, saying there's a data saying that after the vaccine, the protein aggregates are known in a vaccine, known to spike somewhat of an increased coagulation state. And there's been some research to support that. I agree with that. The research is there. It's not clear how that translates to clinical reality. And I will tell you, the active COVID does this 10 times more. There's no question about it. And the more severe COVID is, the more clotting happens, the more hypercoagulable blood becomes. And that's why, especially in the beginning, when cases were really severe, a lot of patients were getting anticoagulants as part of the hospital admission treatment. Whether or not anticoagulants needed outpatient, nobody fully understands and knows. I would say probably not. But if you want to take a baby aspirin as part of, like, I don't know, fever care or something, I don't see any problem with that. So that's, I just wanted to point that out, since this comes up a lot, especially from sort of anti-vax group, where they're like looking for anything. Yeah, sure. I mean, everything has some side effects. The question is, what's the balance of benefit and side effects here? Okay, Jennifer has a question. How do you get the curcumin form of turmeric? Yeah, well, so the curcumin is the actual spice. So you literally, you just take the spice, and literally, I guess if you get a decent organic, you can probably just put it in the capsules. I don't know if you can simply eat it. So a half a gram of turmeric would be a quarter of teaspoon, I think, something in that range. So I mean, could you just put the turmeric and eat it before every meal like a drink? Maybe, maybe not. There are some questions that were remaining, because what if this turmeric is particularly specific to the Thailand production? Could be. What if this only works in people who live in Thailand because they expect that the turmeric is going to cure every ill in the world, right? Well, actually, Dr. Frame and I and our team were trying to actually, we contacted an IH. We talked to the person who did the study, and to the government pharmaceutical organization leadership that created the pills, the turmeric curcumin pills. And they're very interested in collaborating with us. So we'll go to an IH and see if we can get money to do something. I think this would be a great trial. I'm the first person to tell everybody, get off your proton pump inhibitors, get off omeprazole, Protonix, Nexus. Bad pills. In fact, Dr. Frame and I today were just discussing, we're going to do a special podcast just for that, because there's so many side effects from these pills. I think it's essential that we record this and discuss it, especially in view of the alternative treatments that can work. So. All right. Cecilia's, let me read this. Forgot my glasses somewhere, sorry. Moderna COVID shot on Saturday, no side effects, except possibly something that felt like insect bites that evening. Wiped my arm without. Okay. Protocol I used to drink. Okay. All right. That sounds good. Sounds good. Okay. A friend was able to get shot at Vulcan CDS. Okay. All right. Thank you. Okay. Some sites saying that the most turmeric is full of heavy. Yeah. I mean, you hear this all the time. I don't know how much you need to trust all this. Get organic turmeric turmeric from sort of trusted source for sure. Does trusted source have to be US based? Not necessarily. I think as long as it's a good company with a good sourcing, it should be fine. What I don't know, frankly, right now is, if you wanted to take the supplement for that, what would be the best product? We're in the middle of trying to answer that question, because if you look at the very trusted partners like Thorne and Designs for Health or whatever, all of their products are extracts. So I wouldn't use those, because we don't know whether or not actual terpenes, actual flavonoids, and all those active ingredients are concentrated or taken out. There's no way of easy answering this. We can't go to each manufacturer and say, give us your tech specifications to tell us what's in there. It's way too much work. It's impossible to do on a, for anybody. It's too much work. But stay tuned. We'll find something, I'm sure. We're also going to talk to the Thai government and see if we can actually get their company find a partner in US so that they can actually import the products. I guess that's my signal. Well, Shervon, thanks so much for coming, everybody, for a treat. And Shervon goes for the whole left 45 minutes or so. So thank you very much.
Thank you, Misha. And I am very happy to be here with you all today. And it is a nice sunny day in Maryland, which I'm pointing that out because it won't be a sunny weekend. So this is going to be lovely. So today our topic is conscious cannabis and mindfulness. And I understand that for a lot of people, those two things don't necessarily go together in a nice, comfortable way. And so I want this to be, especially in the Q&A time, a nice discussion, to really talk about the benefits of thinking of cannabis in this way. And so most of us, when we think about cannabis, we think about it in the recreational sense. People who use it to party, have fun, maybe relax, or even escape from their day-to-day life or troubles. And while that is true, that has been a limited view and use of cannabis over time, especially in this country. The other way that we now look at cannabis, especially for the research that has been coming out, is this medicinal wonder. I think I heard somebody use that term recently. And it can help with, of course, symptoms from cancer treatment to chronic pain to digestive issues, as well as autoimmune issues, epilepsy, fibromyalgia. And fibromyalgia is what got me interested in the use of cannabis in my early 40s, because I had been dealing with the symptoms of fibromyalgia for probably about 10 or 12 years at that point. And it definitely helped me to better manage my pain, as well as the digestive issues that I was having that went along with the fibromyalgia diagnoses. And so those are the main ways, at least right now, that we think about cannabis in this country. And there is a larger view of cannabis that is not often talked about, and maybe most people don't know about, is that cannabis has a long history as a spiritual guide for self-awareness, for inner work that people do. And around the world, long before we started using it for recreational uses, cannabis was used as a spiritual tool for transformation. And so one of my favorite areas of the world where cannabis has been used in ancient times is India, in the Indus Valley, where yoga evolved along with humanity. And some people are also able to trace even the earlier roots to yoga back to ancient Egypt. In either way, whichever place it came from, both places have a history of using cannabis for spiritual practice. And so in the Patanjali's Yoga Sutras, as well as in the Vedas, there are references to cannabis, plant medicine, as well as meditation and what we call asana, yoga asana. And so in the Vedas, in the earliest books of the Vedas, there's a quote that's been translated that says, it talks of attaining spiritual states of union through the use of cannabis. And in one of the later books of the Vedas, cannabis is said to be one of the 5 most sacred plants humanity has to release anxiety. It is a heavenly guide. And in those times, and that's about 2000 years BCE. And in those times, they also used to use cannabis and make it into an elixir called soma, which I love because, you know, we have our word, especially in the therapeutic communities, we talk about somatic experiencing and dropping into your body. And they had already discovered that cannabis has a positive effect on your somatic awareness. Another story that I love, being a yoga teacher, I heard this story early on, and it dawned on me once I actually came to the use of cannabis in my 40s, really kind of what the implications of this story was or is. So the story is about Lord Shiva, and it is said that he brought down the cannabis plant from the top of Mount Kailash after it sprang up spontaneously, after he swallowed up the poison that the demons were going to unleash on humanity and all of creation. So in that saving of creation, he also came to humanity with a gift of cannabis, which he gives to the people, and they begin to cultivate. And of course, it spreads around the world, right? Because cannabis grows almost everywhere. And so from that time, there's been these celebrations and high holy days that incorporate cannabis that is ground up in a mortar and pestle and put into milk and ghee and some spices, and they call it bong, which is one of those words that we still hear in our modern times. And if you're ever curious about making a bong drink for yourself, you can definitely Google it. There are recipes online. So those are the early references. So we're going 2000 BCE to get these references. And then in a lot of other ancient spiritual texts, sacred medicines are also referenced, and cannabis being one of them. So cannabis sativa, when used consciously and with intention in the right setting, right? And so bringing conscious awareness to your use of cannabis and setting an intention for that moment that you're using cannabis, and being really one with the environment that you're in. So not in a party place, not in transition from one place to another, but really setting the tone in your environment, or being in an environment that really likens itself to calm and connection and inward focus. Allows one to deepen their inner awareness, to resolve inner tensions that are deep in the body, and then to release traumas that are trapped basically in one central nervous system. And that really helps for making somatic trauma work more efficient and more effective. And so that is a lot of the work that I do with clients, is helping them to shift their engagement and connection and use to cannabis, so that they have more to get out of the process than just fun and excitement, and or maybe escapism. So when you take conscious intentional use of cannabis and you pair it with what we now know in our modern mainstream times as traditional mindfulness practices, such as yoga asana, meditation, breath work, journaling, and introspection, you take those two things and you bring them together. It can lead to profound insights, self-awareness, growth, spiritual growth, as well as transformation. In my work with cannabis, I work one-on-one with individuals offering cannabis-assisted psychedelic therapy, as well as in small group settings for conscious cannabis circles. And in both those settings, it's really about helping people to reframe and come to their cannabis in a different mindset. And so when I'm working one-on-one with someone, I work with them around the issues, the goals, the intentions that they want to work on in a private one-on-one session. In a circle, it's about bringing people together in community so that in that space or the container of intentional conscious use of cannabis, people can experience a similar level of transformation and growth and find themselves in a different place with their favorite medicine. And then in Canna yoga classes, people will often imbibe before class. And I've been teaching yoga since 2012. And in the first probably 5 or 6 years, I had no idea people were using cannabis before they came to class and then doing their class. In those first few years, I thought people were really just into yoga. And then I realized somewhere along the line, they were putting it together. But it allows people to have, again, dropping into the body and have that somatic awareness and really embody and inhabit their complete physical well-being, physical being. And so what I'd like to offer for you all today is a meditation that includes a body scan that I use with my clients when I do a cannabis-assisted psychedelic therapy session. And then we'll do a bit of question and answer at the end. And so I would invite you now to take a couple of minutes in your space, either getting into a comfortable seated position, or if you have a space where you can lie down, then for you to lie down and get as comfortable as you would like. And I'm going to do a little techie thing and pipe in a bit of music while you do that. Okay. And if you can just give me a thumbs up and somebody let me know if you can hear that and still hear me, that would be great. Okay, thank you. All right. And so as you're invited to get into your seated or lying down position, think about what props you might want to use. A pillow or blanket, cross legs, legs laid out straight. If you're in a chair, see if you can allow your soles of your feet to be on the floor. And then once you're in a place of comfort, go ahead and close your eyes or lower your gaze. And then connect to the breath. Notice the air moving into your nostrils, down the throat, into your lungs. And notice as you exhale that air reversing course. Notice the sensations in your body. And then give yourself permission to shift one last time for comfort before committing to stillness. And so allow yourself to tune into where you feel your body meeting up with either the floor, the chair, and as if you had a spotlight on your inner body, allow yourself to gaze down to the soles of your feet with that spotlight. As you breathe, allow energy coming up from the earth through the soles of your feet. And with every exhale, release tension out of the feet. With each inhale, breathing that light up the legs. And with every exhale, releasing tension now through the calves, the shins, the knees. Staying with the breath, guide that spotlight up the thighs. Breathe here. Giving yourself permission to simply let go. Let gravity do its job. With every breath, let your thighs, your legs become more relaxed. And now taking your inner spotlight into the pelvic floor and your low back. Just let your tailbone and sacrum sink into either your chair or the floor. Relaxing the belly and the low back as you breathe that light into those spaces. And again, exhaling out any tension. Moving that spotlight up into the heart center. And whatever may be heavy on the heart, give yourself permission to put it aside and release it, at least in this moment. Inhaling light and exhaling tension. And bringing that spotlight to your shoulders, your upper arms. Allow the shoulders to relax downward, away from the ears. And let that spotlight move down the arms into your hands. And as you exhale, releasing tension out of the fingers. Taking a breath and bringing that spotlight to your neck, to your throat area. Move it up into your head. And as you do, relax your jawline, your cheek muscles, your eyebrow line. And as you release that spotlight through the top of your head, let the back of your head relax. If you're lying down, let the back of your head simply be heavy. Breathing, breathing, breathing. As you breathe here, feel the energy moving throughout and just outside of the body. In these mindfulness-based practices, we bring awareness to our bodies and we use the breath to surrender. So as you breathe, release any leftover tension that may still be in the body. Give yourself permission to simply let go in this moment. Breathing, breathing, breathing. Allow your attention to come back to the breath. Allow your breath to deepen with each inhale and exhale. And then gently begin to bring movement back to your body, starting with wiggling toes and fingers, twirling ankles and wrists, and then moving the body in whatever way you feel like you need to reawaken. And before you open your eyes here, ask yourself inwardly this question: what do I need more of today? What do I need more of today? Just allow yourself to hear the answer, and as you open your eyes, bring that answer with you back into your day. And so when you're ready, move slowly. And you can, if you're lying down, roll to one side and push yourself up to a seated position. And then we'll, as one of my teachers like to say, we'll circle back up and turn our cameras back on. And so that is one of the meditative practices that we offer in cannabis-assisted psychedelic therapy. And so if you can imagine coupling that practice, that mindful practice, with intentional conscious cannabis use, you can wind up in some really magnificent psychedelic spaces. When cannabis sativa is used and blending a sativa with an indica, and usually there's a hybrid in there somewhere, it really, in this kind of setting, brings about something quite beautiful. And most of the people I've worked with already have a relationship with cannabis. And time again, I keep hearing this statement that I've used cannabis for years and I've never had that kind of experience. So I would invite each of you, if you feel so inclined, to, if you have a practice with cannabis, to bring that into your mindfulness practice. And I would encourage you to bring a journal with you. Thank you.
Well, thank you. We have a good amount of time for questions. Sure, it
Yes.
generated probably a flurry of interest. So
Okay.
if anybody wants to ask the question verbally, just raise your hand. I'll keep an eye on the chat. Otherwise, type things in. That's also totally fine.
You're welcome.
Shervon, let me ask you a bit practical question.
Mm-hmm.
I think there's still a lot of stigma. People often afraid that taking psychoactive substances can end up having some kind of long-term consequences. I mean, we of course all know that cannabis has addictive potential in small proportion, but
yeah.
Walk us through what side effects are you observing? How are you managing them? I think that question, I'm sure that a lot of our listeners would want to hear. I mean, it's just like any other substance. It has some.
Yeah. Exactly. The side effects that I see are the normal things that you would think of in reference to cannabis use. People do get the munchies. That is a thing. And so usually when I do one of these conscious cannabis circles or cannabis assisted sessions, I always make sure there are snacks on hand at the end. Dry mouth, depending on certain strains. For some people, there is a fear of paranoia, that feeling of paranoia, because they may have had it before in the past. And so that's what blending the strains is about, is that when you take one of those high THC sativa leaning strains and you pair it with an indica strain, it oftentimes will then cancel out the higher experience of, say, paranoia, but it also cancels out that kind of couch lock feeling that people talk about with an indica strain. And so I teach people how to do that, and to do that in a way that it works best for them. And then we also keep CBD on hand for all of these kind of events, because that will help to neutralize any of that kind of experience of paranoia. So far, I've been offering these for 3 years in person and online, and I have not gotten a client who had that kind of paranoia experience. But we, of course, have been at least trained to look for it, ask about it, and so forth. So those are the things that I've seen. I have worked with clients who have described their own personal cannabis use as very much so an addiction. But when they start to reframe their experience and their use of cannabis in this kind of conscious and intentional way, there seems to be a shift that happens for people that I've worked with. And I had a gentleman in the last Conscious Cannabis Circle that I did. He is almost a daily user. And he talked about the fact that he would use cannabis and he was always moving and doing. And he had never, number one, thought about doing it ceremonially, but he had never also thought about just stopping and experiencing the somatic experience that cannabis brings. So some of that too is this kind of habitual thing that we do with cannabis and other substances as well, where we get into these habits and we don't think about or think outside of our own boxes as to what else this substance can do for us.
Yeah, I mean, I think it's essential to understand that, cannabis has been used this way ceremonially for millennia. In fact,
Yeah.
probably the first most recorded use ceremonially is from First Temple in Israel, where it was thought to be the number one tool that was used by every rabbi in the beginning. It's not really clear why it got discontinued, but
Right.
it seems to be pretty clear that was the main tool back in the day. But if you look at other cultures, it seems to be consistent throughout a lot of different cultures. In Chinese medicine, they actually talk about not just using cannabis for both yin and yang conditions, but also for unsettled spirits.
Yes.
It's psychoactive form for more than 5,000 years, for sure there.
Mm-hmm.
I'm sure that guided, and they probably were using it in combination, just like we would with all kinds of other things.
I bet. Yeah. Other questions?
You may want to put in the chat how people can get hold of you, and maybe the link to your website as well. While
Okay.
people are shy, people are afraid of us. It also,
This is one of my favorite topics. So, I mean, we could go on.
we're all safe. Maryland, DC, Virginia, all legalized medical. Maryland,
Yep.
legalized recreational. You're asking questions not going to by any stretch. If you don't want to be seen, just turn off your video or put the question in the chat. We'll make it anonymous if you still don't want to be seen asking something.
All right, I put my website in the chat. It's restoretranquility.com. If you are on Instagram, it's also at Restore Tranquility. And so you can reach me at either location.
Janet, who's next week with us? Okay, thank you for that. Well, I guess it's just I'll keep questions because I have a lot.
Go for it.
Yeah, so we get a lot of people coming in with all kinds of chronic pain syndromes. I mean, we know that the cannabis is very effective for all kinds of pain.
Yeah.
But I always wonder that the cannabis can also be profoundly effective for existential suffering, for kind of existential pain. I don't do this, so I don't actually observe that, but I would love to see what you've seen in practical aspects, like when people coming in and it's pretty clear that they're suffering, not just because they have pain or some other medical problems, but they clearly suffering from just a bigger set of issues.
Yeah.
Have you observed, I mean, we see this a lot with trauma, but the way we think of trauma has a very specific connotations. I kind of want to take it even broader and ask if you've seen things that cannabis helps with suffering, especially when people have faced something very concerning, like a terminal condition or a diagnosis that is very unsettling or could be terminal, let's say like a cancer, for example.
Right. So in the 3 years that I've been doing this work in particular, I have not had a personal client who has had a terminal illness that has come to me, at least not yet. But I have heard from within the medicine spaces where people have had these experiences working with terminal patients, and just the relief, the existential fear being able to be either lessened or removed entirely, and them being able to either move through their treatment or move towards the end of their life in a more peaceful and happy, connected way, especially with family and within themselves. So I'm looking forward to that opportunity to work with one of those kinds of clients. Two of the kinds of clients that I have worked with that was really transformational. Like I could literally see the transformation happen. I worked with a gentleman 2 years ago, who had hard to treat depression. The kind where you go through every single medication that a doctor could prescribe and it touched nothing. And he came to me because he said the only times he would ever get any kind of brief relief was his psychedelic trips that he would take sometimes with friends. So he did the 2-day cannabis-assisted psychedelic sessions with me. And I literally, before the sessions were over, could see his countenance change. I had never witnessed that, like in person, that quick for anybody. But it was amazing to watch. And he came out of those sessions lighter, clearer, able to make decisions that he had been mulling over for months. And that, as a therapist, as a person who had been a therapist for over 15 years at that point, it was quite remarkable. And then another person that I've worked with who had severe anxiety, similar, just so you could see the anxiety on him. And in the middle of that first session, you could see it lift. And when he sat up, and I had worked with him for a while, that was the first time I'd seen him smile. So it definitely, for those kinds of deep existential or mental health kinds of diagnoses where they're not finding relief in other places, can be a blessing for them.
I think the next question is really more for me. I don't know if you've had experience with it, you by all means mention this, but I mean, I've recommended for a lot of patients with long COVID, Jennifer, particularly for patients with long COVID related symptoms of chronic pain, anxiety, sleep problems. Cannabis is often first line for those patients, in my opinion, just because I'm really worried to give those patients things that have more potential for side effects. There's definitely now. Will the cannabis treat underlying cause of long COVID? I don't think so. I think it's more complex. I would probably think that, but for symptoms, absolutely. Top 3 ideas, basically, usually. So that's the way I see it.
Yeah.
Well, I think we have time for one more question. Otherwise, the program for next week. You know where to find Shervon. Again, her links are in there. We'll make sure that they're also posted when we record this and put it on our YouTube channel. Otherwise, everybody have a wonderful weekend. Enjoy a magnificent fall. It's nice and warm. Get outside.
Indeed.
And be present to nature all around us, including the cannabis, which unfortunately you can't find in the wild, which is unfortunate. But maybe like we're looking for mushrooms in a while, we'll be able to
There you
find.
go.
We're not quite there.
Thank you. Take care.
Bye, everyone.